One of the top mesothelioma specialists in Philadelphia is Dr. Bruce Robinson at Penn Medicine. Dr. Robinson is a thoracic surgeon and the director of the Penn Medicine Pleural Center, which offers comprehensive care exclusively dedicated to patients with pleural mesothelioma and other pleural diseases. As the director of the Pleural Center, Dr. Robinson oversees a multidisciplinary team approach to treating mesothelioma. The team includes medical oncologists, radiation oncologists, pulmonologists, nurses, dietitians, social workers, and others who collaborate to develop individualized treatment plans tailored to each patient's specific situation and goals. Their clinical trials and research help advance new treatments and procedures for better outcomes. Dr. Robinson has over 25 years of experience performing surgeries to treat mesothelioma and other cancers. He is one of the most highly experienced surgeons in extrapleural pneumonectomy, EPP, a complex procedure to remove the pleura, lung, diaphragm, and pericardium. EPP offers the potential for longer survival times but is high risk and only appropriate for select patients. Dr. Robinson's extensive expertise helps maximize the chances of a successful operation and minimal side effects. In addition to his clinical practice, Dr. Robinson leads innovative research studies. One area of focus is investigating novel targeted drug therapies and immunotherapy approaches that may provide alternatives or complement standard chemotherapy. He also works to identify biomarkers in blood and tissue samples that could help determine which treatments will work best for individual patients. The goal is more personalized care tailored to the molecular profile of each person's cancer. Dr. Robinson regularly presents his research findings at major medical conferences and works to educate other physicians worldwide on best practices. He has authored over 150 peer-reviewed publications and book chapters on topics including mesothelioma pathology, staging, multimodality therapy, and new developments. His scientific leadership and clinical skills keep the Penn Pleural Center at the forefront of the field. Another excellent mesothelioma specialist at Penn is Dr. Eduardo Villar-Sanchez, a medical oncologist who specializes in treating various thoracic malignancies including mesothelioma. Like Dr. Robinson, Dr. Villar-Sanchez is an integral part of the multidisciplinary Pleural Center team and takes a comprehensive, individualized approach to each patient's care. In his clinical practice, Dr. Villar-Sanchez prescribes and manages chemotherapy, immunotherapy, and clinical trial therapies for mesothelioma patients. As a medical oncologist, he has extensive experience with the standard first-line and second-line chemotherapeutic regimens used to treat mesothelioma, including pemetrexed and cisplatin or carboplatin. He actively enrolls eligible patients in novel drug trials being investigated as alternatives or additions to standard therapies in hopes of improving outcomes. Beyond his work directly treating patients, Dr. Villar-Sanchez leads multiple research studies focused on mesothelioma. One such study aims to identify genomic biomarkers in patient tumors that could help predict responses to different therapies. A better understanding of the molecular drivers in each person's cancer may one day enable truly customized treatment selection. Another research focus is investigating immunotherapy approaches either alone or in combination with chemotherapy to harness the immune system against mesothelioma cells. In addition to his expertise in medical oncology and research, Dr. Villar-Sanchez presents his findings widely at top conferences. He has authored numerous publications in respected journals highlighting research advances as well as his clinical experiences and insights on managing patients with mesothelioma. His multidisciplinary work with thoracic surgeons, radiation oncologists, and other specialists at Penn Medicine's Pleural Center provides the most thorough evaluation and integrated treatment planning available for each individual. Another highly experienced option for mesothelioma care in the Philadelphia region is Dr. Joel Friedberg at Penn's Abramson Cancer Center. As a medical oncologist and associate director for clinical research, Dr. Friedberg treats various thoracic malignancies including mesothelioma. He takes a comprehensive, multidisciplinary approach in collaboration with surgeons, radiation oncologists, and other specialists. In his clinical practice, Dr. Friedberg prescribes and manages chemotherapy, immunotherapy, and targeted therapy regimens for mesothelioma patients based on their individual situations. He has extensive familiarity with the standard first-line and second-line systemic therapies used against mesothelioma, including pemetrexed, cisplatin. In appropriate cases, he also assists with coordinating multimodality treatment including surgery and/or radiation. Beyond treating patients, Dr. Friedberg leads numerous investigative studies. Areas of research interest include evaluating novel targeted drug therapies and immunotherapy approaches for mesothelioma, both as alternatives to standard treatments and in combination with them. The goal is exploring new options that could improve response rates and survival. He also works to identify prognostic and predictive biomarkers through analyzing patient samples in hopes of enabling personalized treatment selection based on individual tumor characteristics. Dr. Friedberg's work has been published in numerous peer-reviewed journals and he regularly presents his research findings at major conferences worldwide. His leadership positions with the American Society of Clinical Oncology and other prestigious groups help advance understanding of mesothelioma nationally. Philadelphia area patients have access to innovative clinical trials and the collaboration of experts through Dr. Friedberg's involvement with Penn's internationally renowned Abramson Cancer Center. In conclusion, Drs. Robinson, Villar-Sanchez, and Friedberg at Penn Medicine and the Abramson Cancer Center offer world-class expertise in mesothelioma as leaders in clinical care, research, and multidisciplinary treatment. Their comprehensive pleural center and involvement in investigative studies provide the most advanced evaluation and up-to-date therapies available. Patients in the Philadelphia region facing a mesothelioma diagnosis have exceptional options for customized treatment planning and care through these specialists. Their extensive experience, innovative research approaches, and integrated team model work to maximize patients' responses, quality of life, and long-term outcomes.